Hi YouTube, I hope you're doing well. Tonight will be the fifth ancient Greek lesson for me. Will be pretty interesting um, for several reasons. There's a lot of drama going on in that community, but it's the only place where I can hear that language spoken where I can learn it. So um, he's the best at what he does in that community. So anyway, but that's not my topic today, and that's over on Lady Babylon. That'll be tonight. But I'm going to be talking about depression and different things that cause it. And when I was told basically like, here's some pills, and I came to the conclusion, I mean, after my medical doctor and a psychiatrist I had gone to see, she started crying. It's like I felt like I didn't have anywhere to turn. And I came to the conclusion that sorrows in our lives and like injuries and sickness and different things. I mean, I knew a lot about psychiatry and psychology anyway, having worked in that field and worked in the medical field. They a lot of times might go hand in hand if you have a really good functioning system like a hospital or a care sitting facility for the elderly or whatever it is. Um, they might have staff that work on the emotional care of people as well as their physical being. And I've seen it. It's not really. It's more. They're more apt to have it in recent years than they were, say, like 10 or 20 years ago or more. You know. But I'm going to read you some things on what they call anhedonia. It's when we feel like we don't have any feelings, but our brain tells us we have feelings, but inside we feel like empty. It's like we're grasping at it. I told Doug I used to feel, I've told him this several times, and now I've heard other people say it, but I used to see the world in like gray. Everything was just like dark, and then just, I don't know, probably like towards my 20s, but when I got a little older, everything just, it was like in color, it was like Technicolor versus a black and white TV in my life. It was just strange, but it actually is a real thing, and I wasn't the only one that it had happened to. So I know it is a real thing, but I'm going to read you some things on this. So just a minute here. Um, so it's just real quick. Um, this is out of the Dia Diagnostic Statistical Manual, the American Psychiatric um, Manual. It's called the DSM. This is the fifth edition. Anhedonia is defined as lack of enjoyment from engagement in or energy for life experiences. It is a component of depressive disorders, substance related disorders, psychotic disorders, and personality disorders. The DSM 5 defines anhedonia as markedly decreased interest of pleasure in almost all activities. In the DSM-3 diagnostic criteria of MDD, anhedonia was described as loss of interest of pleasure in all or almost all usual activities and pastimes. I'll read you pretty good article I found on a place called Very Well Mind, and it's written by Cynthia Venib, PhD. The article was written May 8th of 2023, so it's pretty current. Okay, just it. I'm just going to take my time here and maybe whatever I'm reading, I'll tell you if it's my comment or their content. So, anhedonia is the ability or reduced ability to experience pleasure. It can involve lack of motivation to seek out pleasure or lack of enjoyment in pleasurable activities as they're being experienced, or both. It's one of the primary symptoms of depression, as well as several other mental health conditions. In this article, we'll discuss the different types of anhedonia and cover the symptoms and causes of anhedonia. It will then explain how anhedonia is diagnosed and described possible treatment options. What are the symptoms of anhedonia? Okay, good. The fifth edition of the American Psychiatric Association um, Diagnostic and Statistic Manual, DSM-5, defines anhedonia as markedly decreased interest of pleasure in almost all activities. It isn't the same as losing interest in an activity because you're bored and want to try something new. Instead, it entails a lack of pleasure in almost all activities you once enjoyed. Anhedonia has two distinct components: a motivational component that entails the decrease in a drive to seek out once pleasurable experiences, e.g., looking forward to motive coming out or a beloved family member visiting. A customary component that entails a reduced ability to experience positive emotions in response to activities that used to bring pleasure, e.g., spending time with friends, eating, or previously enjoyable hobbies. People may also, oh wait, people may experience one or both of the components of anhedonia. The DSM-5 identifies anhedonia as one or two of the symptoms of major depressive disorder. In addition, anhedonia is often associated with conditions such as bipolar disorder, schizophrenia, substance use disorder, chronic pain, Parkinson's disease, Alzheimer's disease, eating disorder, and post-traumatic stress disorder, autism spectrum disorders. The experience of anhedonia may differ based on the condition um, it is a symptom of. For example, research has found that those with major depressive disorder and bipolar disorder may experience motivational component of anhedonia, but the consumeratory, but not the consumeratory component. As a result, these individuals are capable of experiencing pleasure in response to an enjoyable stimuli, but are not motivated to seek out such experiences Meanwhile, other research has shown that those with major depressive disorders suffer more severe anhedonia than those with conditions such as schizophrenia, substance use disorder, Parkinson's disease, and chronic pain. Types of anhedonias and their symptoms. Many studies divide anhedonia into two categories: physical anhedonia and social anhedonia. These two categories are correlated, but each describe defects in different kinds of pleasures and have separate symptoms. Physical anhedonia is defined as reduced interest and pleasure in engaging in physical experiences such as food, exercise, sexual interactions. Symptoms of physical anhedonia include reduced interest in physical intimacy, no longer finding pleasure in tasting food, diminished enjoyment in physical sensations like dancing, smell of flowers, or watching sunsets. Social anhedonia is defined. Just a minute. I'm going to take a sip of my coffee too. So I'll get back to the social anhedonia. Just a minute. Because I know a lot of people are like stressed out, uh, trauma, around narcissists. I mean, there's a lot of depression in the world for different reasons. And even a narcissist, I believe, suffers from forms of anhedonia. I really believe that. Okay, just a minute. Okay, social anhedonia is defined as reduced interest and pleasure in social engagement. While social anhedonia involves social withdrawal, it isn't the same as social anxiety. Social anxiety stems from fear of social interactions, while social anhedonia disease, the rewards of, oh wait, while social anhedonia disease, oh, decreases, excuse me, while social anhedonia decreases the rewards of social interactions. Symptoms of social anhedonia include social withdrawal, feel fewer personal relationships, preference for being alone, reduced social skills, reduced enjoyment of social interaction. And there's another article that goes off into how important is alone time for mental health. Okay, what is the main cause of anhedonia? It is not entirely clear what causes anhedonia, but scholars suspect it is the result of change in the brain. Some studies have suggested that parts of the brain that enable people to anticipate rewards and motivate them to seek rewards out are compromised in those with anhedonia, which diminishes their ability to make decisions that would lead to pleasurable experiences. Once found that children with anhedonia had lower levels of connectivity between the regions of the brain involved with arousal and reward processing, as well as decreased activation in certain areas of the brain during reward anticipation. Diagnosing anhedonia. In clinical settings, a medical or mental health professional may diagnose anhedonia by asking questions about patterns, moods, and other emotional responses to pleasurable activities. There may also they may also administer a questionnaire such as the Snareth Hamilton Pleasure Scale, SHAPS, a 14-item measure commonly used to assess anhedonia in people with depression and other mental health issues. Because anhedonia is often a symptom for other conditions, patients may also be assessed for underlying mental health or physical conditions as a result. A physical exam or a blood test may be done to determine if there are other medical problems that could be leading to anhedonia. And that's where I say, like, the physical becomes the mental and the mental becomes the physical, because I know when I've been so injured, I'm depressed. And then if other depressive things happen while I'm injured, I mean, it's like almost all too much. It's like sorrow and pain overload. Treatment of anhedonia. Anhedonia is difficult to treat. While drugs may be prescribed to treat the various mental health issues, it often occurs with research, often occurs with, and then it's got a comma. Research has found the medications typically used to treat depression actually reduce the brain's ability to process rewards, blunting emotions, and do little to relieve anhedonia. Ketamine. Recently, there have been some promising developments in treatments aimed specifically at anhedonia. For example, one study showed that a single infusion of anesthetic ketamine reduced the anhedonia in people with treatment-resistant bipolar depression, representing a potential avenue for helping people with the condition. Talk therapy. Clinical trials are currently underway to develop a customized talk therapy for anhedonia. The therapy involves giving patients weekly tasks such as attending a party or inviting a friend over for dinner. The goal of the therapy is to override the lack of motivation and anticipation people with anhedonia feel, having them engage in activities that will feel rewarding or important. In doing so, researchers hope to create a positive feedback loop that will eventually lead people with anhedonia to decide to engage in social events on their own and even learn to look forward to participating in them. Does anhedonia go away? Despite this progress currently, there aren't specific ways to treat anhedonia directly. If you feel you are suffering from anhedonia, the best option is to seek out mental health professionals who can assess you for the condition and develop a course of treatment that will help you work towards experiencing interest and pleasure in activities you used to enjoy. So, um, yeah, let's see. Oh, my scroll. Okay, I thought that would be interesting um, for people, given that there's many of us that suffer with depression, and like I say, it could be from the physical or the emotional. Like, I mean, it's pretty hard to be happy if you're like laid up with broken bones, or say you went through a divorce and then your parent died, um, different, or you got laid off from your job and then you fell down and broke your hip. I mean, these aren't just brain problems that people are having with the treating the whole person. What I like to refer to as like the trinity of us, our spiritual being, our physical, and our emotional. It's three different components of us that we have to consider whenever there's anything psychological going on with us. You know, like, are you really just crabby? Or is there something going on where you have a chemical imbalance for some reason? And this could be part of the problem, is what I'm thinking. So, yeah, and I listen to psychiatrists and psychologists, and the study of the mind and the body have been a big thing to me. Well, some of you know, one of my first jobs that I trained for was nursing, and then going into physical therapy aid, and then going into paraprofessional for working with handicap and that type of thing. So both the physical and the emotional have been passions of mine all my life. So yeah, but there is actually a description of what people like me are living through. And yeah, my world used to be so dark when I was a kid. I just didn't know that trees could be so green. Or I was listening to, his name is, I'll tell you in a moment here, Dr. Scott Ellers. He was saying how his wife and him had, uh, dang little bug, moved back to Iowa. They had lived there a couple different times, and he's like, wow, they must have really like worked on this place, like cleaning it up and making everything so green and beautiful and all that. And his wife's like, nothing has changed. It's just that the color came into his life. He found ways to overcome his depression. And, it's like he described like your child bringing you something like a grade or something glorious that they had done. And your brain is thinking, um, or rather inside your heart, it's a cool thing, it's glorious, but you just, god dang it, it's a mosquito trying to get me. Um, you just can't make the emotional connection with it that you once might have. It's like a blockage somehow. Like, you feel it but you don't really kind of feel it. Well, there's ways to overcome that through mindfulness, like those steps they said, make a goal, make something like, I had so much anxiety I couldn't even go out into public. But was it really anxiety? Or like I told my stepdaughter, is it just really that in ways that maybe we've been abused in our life or people have been cruel? Who's going to look forward to that? Is it actually something in you, or is something that other people have done to you? um, Making that distinction for me was a big deal. It's like, okay, I'm going to go out here and I am going to be my cheerful self. And it's not being oversensitive, which a lot of people will get labeled. It's not. It's not even being autistic, which they can be labeled like sensory overload, or the need to kind of be seclusive, or um, it it's hard to explain, but there is kind of a connection with autism in that respect too. It's like and sensitivity. It's not and depression. It's not that you're not sensitive. You might be a little bit too much. I don't know. I guess I'm just thinking out loud here. But, but you can overcome it, is what I'm saying. And the more you push yourself to overcome it, if you want to, um, the more you find like tools and way, like if you see yourself slipping into a dark day, do something good for yourself, play some music, force yourself because it's going to change your mood. You need to start in your mind first to heal the rest of you. So yeah, sometimes that actual extra little push, and like I say, it isn't that I didn't care about, say, like my child bringing me their grade. It's that I was so depressed because of severe trauma and injuries that my physical being was off, which affected my emotional self. And a lot of people don't make the connection between like their diet. Well, we're more conscious as a people now with our diets and detoxing and taking care of our emotional health and all that. But yeah, if you can't go out, if you have that going on, sometimes being secluded it's good to chill. I mean, sometimes you do need your alone time, and you know, you'll know when it's right to go out and interact. And if you really do have to force yourself to do that, if you think that's the best thing for you to do, I'd recommend it. But I wouldn't recommend letting anybody give you any drugs to deal with any kind of depression. Um, it doesn't work. God in my heart help me. I can recommend that for somebody to have that in your life as a daily thing. Yes, we had somebody that loves us, that made us, and he doesn't want to see us sad or hurt or any of that. And if that, whatever helps you, if you can find like maybe somebody that you listen to that brings joy into your life, hopefully they are. Um, I don't know. But anyway, yeah, I almost went somewhere else. I was thinking about a channel that doesn't really bring me joy, so yeah. But, you know, those people with the pony wrote me, and it's like they say I'm like, okay, like a germ freak or whatever. Yeah, in a sense, I really kind of am. I used to make jokes like I'm related to Howard Hughes, and I probably am, but he used to wear gloves even in his own home. He was like germ phobic. It's not that I am like that with a pony and a kid sharing a popsicle. I just told him, hey, this is where I wrote some articles on microbiology, and I care about people. I said, just give me a break, people, you know. And I just left it alone, you know. But they no sense beating a dead horse with a lolly in its mouth, right? What they call a popsicle over in the UK. So yeah, I'm just gonna let it go. I shut off the notifications to it. It's like I can only try. Maybe some people will go over to the link at More Gallons and look more closely into the microbiology, the science of it that's going on recently, and the combinations of bacteriums and how they work inside us against us and whatever. So all I can do is put the information there, you know. They're like, yeah, okay, enough on that. And this was about Anhedonia today. So, yeah. And my advice is to take your chill time when you need it, but know when you need to push yourself ahead. If you're um, secluding yourself from the world for like, I mean, with no human interaction, uh, that's probably really not a good thing. You know, if you're going to shut yourself down cold at a dead stop, yeah, it's probably not going to work out well for human interaction. We have to keep it, it's like exercising a muscle. You got to keep it going to help yourself keep out in the public a little bit. And just enough to let them know, like, no, you didn't make me crawl into my cave. I'm not staying in there. Every once in a while, I'm going to come out and I'm going to spook you because here I am again. That type of feeling. If that's how I do it. It's like, yeah, I'm sort of a hermit. I'm seclusive with my time and my feelings and my friendships, but I really love people and I love being around them most of the time. So, yeah, I wanted to talk on that because I know personally too many people that are in a depressive state. I've watched the life being sucked out of joyful, young, happy people that end up just kind of unhealthy and having to push themselves to even maintain like like a narcissist will try and wipe your happy out of you or steal your smile, you know. Just keep smiling. Like I tell people, even if you have to force a smile, that wasn't forced, by the way, but even if you have to, it creates happy endorphins in you. It will, even that fakeness of creating a smile will create happy endorphins, the good ones inside your mind, that and they actually do help your body heal. So that's my thoughts on um, anodemium. Yeah, and then I go and I know I said it wrong. Just a minute here. Chronic depressive disorder. No, you know. No, maybe I did say it right. Yeah, I did. Pretty sure. Because I knew it was a something, I just didn't know the name for it, you know. But let's see, I have it here. Thought I had it here. Yeah, Anhedonia. Anhedonia. Yeah. So, okay, everybody. I hope that helps somebody out there a little bit because I know with some of the really upsetting and confusing and painful things that we go through in our life, sometimes it feels like our whole world is falling apart and everything's going to be okay. And there are ways to, there's workarounds for all of these physical or mindful illnesses that people suffer, and we can all help each other out here. So I'll talk to you soon. I hope you have a really beautiful night or day wherever you're at. Peace and love from Pine City, Minnesota, USA.